Good morning and welcome to the Caregiver WellMed Charitable Foundation Caregiver Teleconnection entitled Let's Get Physical with Dr. Elliot Montgomery Sklar. Now I got to tell you about this guy. He's pretty famous in our circle of the teleconnection. Dr. Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and caregivers in Canada, Florida, and virtually right here. And his research is focused on the complexity of issues related to aging and caregiving. That's a big mouthful, the complexity of issues, because those of us who are old know that. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally. He recently published research in the American Journal of Occupational Therapy, the Journal of Applied Gerontology, and the Journal of Social Services Research. Specific to our program today, Elliot has led fall prevention programs and fitness programs for seniors and caregivers in South Florida since 2008. Welcome, Dr. Sklar. So nice to have you.
Thank you so much, and welcome, everyone. Thrilled to be giving this talk today. Really, it's something I've wanted to do for a couple of years now. Really, because during the beginning of the pandemic, I think a lot of us felt fear as we went into this national lockdown. It was the first that any of us really had experienced. And for caregivers, the experience was even more stressful as we learned that older people and those with more chronic health conditions were more likely to be significantly affected by COVID. And now here we are, over 2 years later, and I have yet to hear anyone tell us that there is something that we actually could have been doing all along for our health, to support our immune systems, our cardiovascular, our muscular health, our mental health. Exercise is proven to help ward off illness. It's proven to help improve certain health conditions. And yet I never heard anyone say throughout the pandemic that we should be exercising or eating better as a way of helping to improve our health and our resilience. So right now, many places across the country are actually seeing surges again in COVID, though it's not necessarily covered on the news. Yes, the variants continue to seem more and more mild, but it's still out there. And here we are today, and we know that exercise can certainly boost our immune health. Now, I mentioned the mental health crisis as well. We know that many caregivers have experienced a lot of stress as a consequence of the pandemic, or perhaps the pandemic made us more aware of the stress that we were feeling on all fronts. When gyms closed, I looked to my community for exercise. I walked and walked and walked a lot. And I did a lot of thinking about my health and the health of those that I care for. Those walks really helped me get through the worst times of the pandemic, because my goal was really to care for my mental health and my physical health each day. And my goal was to simply take a walk. Exercise, and especially exercise among nature, is proven to boost our mind and our sense of well-being. So with that, I wanted to talk about goals today, because they're really important when we talk about physical activity. So I wanted to ask those of you participating today what your goals are. Obviously, you knew the theme of our program when you registered. So, what are your goals from today's session or from getting more physically active?
This is when you can unmute your phones by pressing *6 or unmute yourself on Zoom. And we would love to hear from you. And I have to tell you, your input really improves our podcast. So we really want to hear from you.
It'll also help me better tailor my presentation and talk today if I know what your goals are.
Good morning.
Good morning.
LaDonna Adkins. I'm joining the conference as I have just recently accepted a new position as an activity director in a facility here in Canyon, Texas, and just looking for some input as to help get my seniors more physical and actively involved help their, mental wellness. Appreciate y'all's time.
Excellent. Glad to
Sounds
have you
like you're in
with
the right place.
Thank you.
And Michelle saying more types of exercise that are good for muscle strength. Also fun exercises.
Fun
like
is
that.
critical. Absolutely.
Yes.
All right. Well, I appreciate that input. I'm going to share a little bit about what my goals are for our time together today. And my goal is for our program to share some new research as it relates to Alzheimer's and dementia, and also stroke, and the benefits of physical fitness and activity. I also want to go through some tips on exercising with a variety of specific health conditions and how exercise can specifically benefit those conditions. Now, of course, as we always provide this caveat, before starting any exercise program or routine, it's really important to speak with your doctor or healthcare specialist. Physical therapy, as an example, can be ideal in helping a person with certain restrictions and getting some health issues sorted out so that you can get started on a customized routine for yourself. So the key there too is that, as we know, physical therapy is often covered by most insurance, at least on a limited basis. So it can be a really helpful thing to get someone started. Now, some people's health insurance plans might also cover fitness programs. I'm going to talk a little bit more about that later, but it's really important to check with your insurance and with your doctor to see what options might be available for you and to also see what things you might need to look out for. Now, another good place to start today is also to remind everyone that when I talk about exercise, my goal here is not to have us all run a 5K. For example, stretching is such an important and overlooked part of what should be part of everyone's daily routine, especially as we age. Stretching is important, and there are forms of exercise like Tai Chi, which focus on flow and movement, and they also don't cause you to break out a sweat. There are things that you can also do in bed, and even using a tennis ball against a wall or in bed against your body can help to massage knots out of your back and also to stretch out muscles. And that's a very inexpensive, easy thing for people to do. So there are also some amazing stretching videos and resources free online, and I'll be providing a lot of those resources. But I think a key here is that you have to find what works for you, because we need to make a habit out of being physically active. And the only way to do that is if you enjoy it or if you reap a benefit from it. I've find myself very fortunate because I have come to really enjoy exercise. It's not something I can say was true throughout my life course. But I think my goals have also changed. As we're younger, our goals for fitness are sometimes vanity and to look better. And as we get older, it may relate more to our mental and physical health. And I'm very fortunate because I've also seen the benefit in my own health. Since I started exercising routinely about 4 years ago, my A1C has gone down, my blood pressure has gone down, my cholesterol has gone down. So the benefits are very clear. I see it in my lab work and it keeps me going. And I wanted to share some new research as it relates to exercise, specifically Alzheimer's and dementia. Now, as we age, we have concerns, obviously, about the increased risk of dementia. And as our population gets older, that risk increases. Now, a lot of people have asked in previous programs, what can we do to prevent it? And is there anything we can do to prevent our risk? Now, this is, I think, especially important as the number of older Americans is rising, and so have the number of people with dementia. However, some studies have shown that the incident rate of dementia, meaning new cases in a population over a certain time, have decreased in certain locations in the US. Now, based upon those observational studies, factors such as healthy lifestyle behavior and higher levels of education, interestingly, may be contributing to that decline. But the cause and effect is uncertain. So we have still more research that needs to be done. But what's exciting is that a review of recently published research evaluated evidence from clinical trials on behavior and lifestyle to prevent or delay Alzheimer's or age-related cognitive decline. And the review found encouraging but inconclusive evidence for 3 types of behavioral change: physical activity, blood pressure control, which we know is linked to physical activity and cognitive training. Now, these findings mean that interventions in these areas might be promising enough that researchers can keep on studying from them to learn more. There's other research that has found previously that men who use Viagra regularly, and this one was very interesting, had a lower incidence of developing dementia and Alzheimer's. And that's something researchers are looking into because we know that Viagra promotes blood flow, and that is similar really to what exercise does. Well, it's pretty interesting. Now, there's also some new research that has come out about strokes. Strokes, as we know, are very serious and are very prevalent. In fact, 1 in 6 deaths, according to the CDC in 2020, was due to a stroke. Now, furthermore, every 40 seconds, someone in the US has a stroke, and every 3.5 minutes, someone dies of a stroke. But here's the amazing news. Vacuuming, mopping, walking a pet, or playing catch can be enough physical activity to actually avoid a stroke. It's pretty tremendous. So again, reinforcing that you don't need to run a 5K. Doctors found that doing daily household chores can significantly reduce risk of a stroke. This is a study that has come out from San Diego State University, close to you, Evelyn, in partnership with the American Medical Association and the Journal of the American Medical Association. And they found that doing light intensity daily activities, just like household chores, can significantly reduce the risk of stroke. The research measured the amount of time that participants were sedentary and the duration and also the intensity of physical activity in 7,600 adults 45 years of age or older. And they compared the data to the incidence of strokes in participants over a course of 7 years. So it's a really solid research study. And they found that those who were sedentary for 13 hours or more a day had a 44% increased risk of having a stroke. Now, wanted to just pause there because I know there's a lot of research, but did anyone have any questions about any?
Please go ahead and push *6 on your phone, or you can unmute yourself on Zoom. We can see who would like to tell us something. I think that's an amazing research project.
Certainly is enough to get me walking more.
No, I was talking about the household chores, Elliot.
Yes, but one of them is walking a pet, and I have a dog, so.
Aha, okay. Anybody else? Okay.
Well, I also wanted to talk certainly about caregiver mental health. As we know, caregivers experience higher levels of depressive symptoms and anxiety. And we know that depression and anxiety disorders found in caregivers can actually worsen after a patient might be placed. There can be sometimes more anxiety around that, sense of having less control, worry about that person. And, you know, there's just so much research. We've talked about it a lot, and people participating today probably know this, but a lot of caregivers feel exhausted when they go to bed, that female caregivers fare worse than their male counterparts. I suspect that there is some underreporting here because we also know that men are less likely to self-identify as caregivers or also to be forthright about the struggles that they may be experiencing. But we know, of course, exercise has tremendous mental health benefits. And caregiver physical health also is very significant because generally speaking, caregivers are in worse health. About 1 in 10 report that caregiving has caused their physical health to get worse. And caregivers also report chronic conditions like heart attack, heart disease, cancer, diabetes, arthritis at nearly twice the rate of non-caregivers. Caregivers also suffer from increased rates of physical ailments, including things as insignificant as headaches, pain, or physical aches, or acid reflux. But these things can develop into further serious issues. For example, obesity. You know, if we feel like we're not feeling too great, we don't want to move as much, we're seeking comfort. Now, the physical stress of caregiving can certainly affect the physical health of the caregiver. And we know this too. 10% of primary caregivers report that they're physically strained. Caregivers have lower level of self-care. And despite all this, there's very little talk about the importance of encouraging exercise for caregivers, which really is a natural antidote to stress, depression, anxiety. Now, I know that being a caregiver can also sometimes make exercise more challenging. Certainly, if you want to leave the house and you need respite care, or, for example, I've talked a lot about the fatigue that is accompanied with caregiving responsibility. So many of you are probably wondering, well, how do we get motivated to want to engage in exercise if we're so tired? So I wanted to open that up for conversation a little bit because I know that it's an inherent challenge.
Just press *6 if you're on the phone or unmute yourself.
What are the barriers for you participating today that you might see in those around you or that you're encountering to engaging in physical activity?
Now, Elliot, I think your idea about motivation is really essential here. We've had people who've told us on the phone, and you've been on these calls, and they basically say, I get so charged up. I want to go out. I want to change, how I'm behaving for better results. And then the Zoom call is over and I go sit on the couch and I turn the TV on. So it's about that motivation. It's about doing that very first little thing, that makes you feel better.
And that's why I say I think it's so important that it has to be something you enjoy. And if what you enjoy is actually sitting on the couch and watching television, that's okay. There are things that we can do while sitting on the couch and watching television, like taking a water bottle and doing arm curls with the water bottle, or doing stretching exercises. The journey can begin with very simple, small changes. I think what keeps us motivated is seeing the results. So if we're feeling better, and it takes about 2 weeks of routine exercise to start to feel some bit of improvement, both to your mental health and your physical health. And getting through those first 2 weeks can be a bit challenging.
Hello, this is Dr. Malakara, Mary Fel Malakara from Charlton Methodist.
Welcome.
Hello.
Thank you. This is one of my near and dear to my heart topics because I am a doctor of physical therapy. So when I advise my patients, 2 things. Number one, I tell them physical activity is medicine. It's the cheapest medicine you could ever get. You don't need to buy it. Second is, I think we are all creatures of habit. And if we are so used to sitting really poses a greater risk of heart disease and other types of, even diabetes, sedentary type of activities. So in order to overcome that, it has to be intentional, in order to form that habit of being physically involved, not exercise. The word exercise sometimes is a stigma to a lot of people. They say, oh no, I can't do that. No, but if we change the mind, the frame of mind as far as how to approach it, we get better results. Thank you.
I really appreciate your input, and I agree. Bless you. I agree with what you shared. It does have to be intentional, and I do think that we need to change our mindset a bit. I look at exercise as part of what my medicine is, as you said. It's what I do every day to be in as good physical health as I can be. And many people don't think of it that way. And that was really where I started to get this idea for wanting to do this program, because during COVID, there was very little talk about the things we could do to help support our immune health and our mental health. And exercise is free and it's there for everyone. Thank you.
Woo-hoo. Anybody else? Okay.
I'm also going to talk a little bit more about stigma in a moment about exercise, which was another really great point. But I wanted to bring up the SilverSneakers program. In case you have not heard of it, SilverSneakers is an exercise program that's been around a long time. They have an app now, actually, that you can download to your smartphone. And they have customizable workouts that you can do from home. but they also have partnerships with gyms and community centers across the country. And this was something I didn't know. In fact, there are more participating fitness locations that are SilverSneaker members across the US than there are Starbucks. So SilverSneakers is a fitness and wellness program that is offered at no additional cost to seniors 65 plus on eligible Medicare plans that help to get you active, fit, and also to connect you with others. It's a nice way to get to know a gym that you might be looking to belong to that also caters to seniors as well. And the SilverSneakers program really is designed for all fitness levels, and it provides access to online, which is very important for our caregivers, and in-person classes too. So I have the link that I will be sharing with individuals after today's program, so you can get to see if there is a local SilverSneakers affiliate in your area. I also recommend not just checking out one gym, checking out a few of them. In my community, for example, there are several gyms that have the SilverSneakers partnership, but only a few that I have noticed where I see quite a few seniors exercising. So it's important that you also feel comfortable in the environment, I think, personally. And another amazing tool here, and hopefully this video will work, I will share this after our program today, but the National Institute on Aging has amazing videos which are free because many of us are looking for online exercise videos, and there are so many. Many of them are also promoted by personal trainers and social influencers, and they may not be appropriate for certain physical limitations or as we age. So this is a really solid resource, and I'll just play a little snippet of the video.
Hi, welcome to Go for Life, an exercise campaign from the National Institute on Aging at NIH. My name is Sandy McGrath. I'm a personal trainer and fitness instructor. We're going to do a sample workout, so you'll be able to watch me and follow along with Mitter, Irene, Griselle, and Jerry. For equipment.
Whoops. Sorry about that.
Hi, welcome to Go for Life, an exercise campaign from the
All right, I'm just going to fast forward into the video.
The rest of you, we're going to grab our weights and we're going to turn around. Now you want your feet to be shoulder distance apart. Pull those, your feet to be shoulder distance apart. Pull your shoulders back, abs in, head is up. Elbows should be tight to the side, and take it up for an arm curl. We're going to do 10 of these. Here we go. And 2.
So the point here that I just wanted to show is that some of the people, if you see they're seated, some of them are standing. They have a ton of different videos for different levels and different goals and abilities. It's really an excellent resource. So we'll be sharing that after today's program as well. And I did see, I saw something in the chat, but Evelyn, you already, already addressed that.
Get ahead of myself.
That's okay, that's great. So I was saying that I wanted to talk about stigma because really anyone at any age can do some type of physical activity, but I think there are a lot of reasons why people don't. Now, some of it, yes, we chalk up to being lazy, but I don't really believe that to be true. You can still exercise, certainly if you have health conditions like heart disease, arthritis, chronic pain, high blood pressure. We'll talk about that more during our program. But in fact, physical activity, as one of our participants said, could be medicine. It's an antidote. I think many people, however, shy away from exercise because of stigma. It's a significant barrier. People who are older and people also who are overweight, as an example, sometimes don't feel comfortable at a gym. And the majority of people in this country are overweight. So these things are not in alignment. There's also racial and gender stigma as it relates to physical activity. Now, it really shouldn't be that way, but we have a long history of associating youth and beauty with fitness, and we need to change that thinking. So if you're overweight or older, or come from a background or a household in which fitness was not emphasized, please don't let that stop you from engaging in physical activity. We know better now. We know the benefits on our health. And in part, that contributes to the disparities that we also are seeing in life expectancy. As an example, Black people have a lower life expectancy and more chronic health conditions, and they also self-report less exercise. And the same is true for people of lower socioeconomic status, and it should not be this way. So if you have difficulty bending or moving easily, or if you feel self-conscious, try different activities that make you feel comfortable, like walking, dancing in your own home, weightlifting. Take a look at what works best for you. My personal opinion is anything that gets you moving, even if it's only for a few minutes, is a great start. And it's hard to make a routine, as I said, of doing something that we don't enjoy or feel uncomfortable doing. So I was curious if anyone participating today had any comments about what I was saying about stigma and how that is, I think, often a barrier.
Well, Michelle Barkley says, my mother with dementia went to my Zumba classes with me and did the dancing while sitting in the chair. And this is the best part. It was super fun for both of us. What a nice thing to tell us. And thank you for sharing that.
Thank you. Absolutely.
Yeah. Anybody else like to share with us? We'd love to hear from you. Let's open up your phone by pressing *6 or unmute yourself on Zoom.
Does anyone feel uncomfortable at the gym? I do. It doesn't.
That's because it's
going.
all women in the class, Elliot.
No, actually. So I belong to a Pilates studio and a gym that is a SilverSneakers partner. And I find that I go to the Pilates classes, which are populated mainly by older women, more than I do go to the gym, because I find I get a better workout and it's a more welcoming environment.
Nice. Very nice. Anybody else?
Well, something to think about.
Are you going to talk a little bit about, like heat and ice and things like that? Oh, good. Okay. Sorry.
Yeah. So now I'm going to seg into the next part of the presentation, which really talks about the benefits of physical activity and tips for physical activity if you have certain health conditions. One of them is dealing with chronic pain, and heat and ice certainly are very helpful. So let me just make sure that I can continue my slide sharing here. There we go. All right. So staying physically active is very important for Alzheimer's disease and related dementia. Just like our participants shared, it is so important that caregivers also include care recipients in exercise, something that we shouldn't just do for ourselves. Like the research I shared earlier, researchers are assessing the benefit of exercise to delay mild cognitive impairment in older adults and also to improve brain function in older adults who may be at risk for developing Alzheimer's disease. Older adults also with mild cognitive impairment may be safely able to do more vigorous forms of exercise like a Zumba class, similar to older adults without cognitive impairment, provided that there are no other underlying health concerns. So again, it's something that we should be encouraging for all people. Being active and getting exercise can certainly help people with Alzheimer's or dementia to feel better. And that's very important, as it is for them to maintain a healthy weight and have regular bathroom and sleep habits. And exercise promotes all of those things. And if you're a caregiver, exercising together certainly makes it more fun. So,
Elliot, I don't know if you forwarded your slides, but I'm still on the NIA slide.
Oh, yes, I did. Hold on. Thank you for letting me know. I'm going to stop sharing and start sharing again. Can you see this one?
Yes.
Okay, perfect.
Thank you.
Apologies.
Thank
you for letting me know. It's that video. So some specific tips that are certainly helpful. And again, no need to worry about writing these down. I'll share all of this after our program today. But tips for helping a person with dementia stay active can include something as simple as taking a walk together each day. Certainly in nature, we know that that's a great benefit. There are exercise videos like the one that I showed from the National Institute on Aging that has specific videos and also dancing together. We know that music certainly helps to promote cognitive stimulation. So that's a wonderful thing to do together. It's also fun. And you can also be reminiscent and listen to some older music or have fun together, really. And this is a good way for those Richard Simmons videos that we talked about before the start of our program today to work their way in. But I think it is also important to be realistic about how much activity can be done at one time. And sometimes you may find that several small mini workouts can be best. That's also why the idea of dancing to a song can be great, because the song is 3-4 minutes. It's very important, and I want to really emphasize this, that the person wears comfortable clothing and shoes that fit well and that are made for exercise. If you're doing something like dancing at home, which can be really simple, make sure that that person is wearing socks that have non-slip tread or non-skid tread on the bottom. Sometimes these are called Pilates socks if you look for them on Amazon. But you want to make sure that surfaces are not going to prove to be any kind of a slip hazard or things like that. You also want to make sure that that person keeps hydrated. This is especially important during these summer months. Make sure that the person drinks water or juice after and during exercise. Now, if the person has trouble walking, there are other things that you can do at home, like sweeping, dusting, some of those daily household chores that I was talking about that help to prevent stroke. They're also very helpful. And stretching is very, very important. If the person can get on or off a stationary bike, that might be a safe option for a couple of minutes. You can also lift weights, as I was saying, with household items like soup cans or bottles of water, as I have here. You can do tricep extensions with them. You can do bicep curls. So it's important to be creative too, as caregivers always are with things that you have around the house. Does anyone have any questions?
Press *6 if you're on the phone, or just unmute yourself. We'd love to hear from you. You know, Elliot, I think I've been doing a lot of exercising, and the more you do, it's the more interested you are in how to do it better, or how to do more stuff, or, you know, how to improve, you know, a certain part of your body. It gets a little infective. It's really cool.
Well, that's the momentum that I was talking about earlier. I feel like it takes people a good 2 to 3 weeks until you really start feeling some benefit mentally or physically from what it is that you're doing. At first, it can seem awkward. You may be not used to feeling soreness in certain muscles or joints, but you know, I can share that when I started Reformer Pilates, I thought it was like a weird crossbreed between yoga and Twister with some sort of like a torture machine.
Spanish Inquisition.
But I've come to love it and find that it helps me to feel more flexible. I have arthritis in my knees after having 2 ACL repairs. So I've learned that exercise is the medicine I need to keep moving, and Pilates helps that.
We have 2 chats. You want to pick those up?
Sure. 1 second. All right. So the first from Pam, it's hard to find a gym that has programs for older people, but not those on Medicare yet. I didn't fit in with the regular gym goers, but not old enough yet for senior programs. It's, I think, a stigma issue that many of us feel and face, you know, a lack of comfort in different gyms or environments. That's why I recommend, if you live in an area where you can safely exercise outdoors, and if you like doing something independently, that can be an option. But I am sure that there are many gyms in your area, and I would try checking out a bunch of them. Also at different times of the day. You know, you'll have different populations at different times. I have found in my gym that mid-morning is really the best time, where I find that there are a lot of middle-aged and older people. I feel more comfortable if I'm there first thing in the morning. It's a lot of the weightlifters, and later in the day too, after work, for example. So I would encourage you to try to check out a couple of different things. And you may also want to try a reformer Pilates class. The first ones at most of the studios are usually free, so it doesn't require any commitment, and it gives you a good sense of something that's quite a bit different. Now, we also had a comment from Michelle, and Michelle said that she found that the senior centers around here have the senior exercises. I don't have to be over 65. I started at 50 and took my mother. Also, our Methodist hospital system has classes for older adults, and it's free. Woohoo. So that's wonderful. And you may also want to try calling 211 for people in your communities to find out if there are free senior fitness programs anywhere in your community. The falls prevention program that I used to run, for example, was free, and there were other fitness programs tied to that, and we worked with SilverSneakers. So try looking to see what resources do exist in your community. And also if your gyms that may not be SilverSneaker partners have any discounts for seniors.
Great. Good
All
resources. Great comments. Yeah, thank you.
So since I talked a little bit about arthritis, this is a good segue here for us. Certainly, exercising for people with arthritis can reduce joint pain and stiffness. That is where I have found Pilates to have benefited me the most. Now, it can also help with losing weight, which reduces stress on the joints, and that's important. Specifically, flexibility exercises, such as upper and lower body stretching, and also Tai Chi can help joints moving, relieve stiffness, and give you more freedom of movement for everyday activities. I have certainly found that integrating Pilates as an example, which focuses a lot on stretching, has helped me to be more flexible. And that's very important. Strengthening exercises like those overhead arm raises that I was mentioning here with my water bottle, they can help you maintain or add muscle strength to support your joints too. Now, the other category are endurance exercises. These make the heart and arteries healthier and lessen swelling and overall inflammation in the body. So these activities don't require a lot of weight on your joints. They can include swimming or biking. I love biking, especially for my knee arthritis. Biking is better for me than walking. And comfortable shoes. I cannot impress enough the value of comfortable shoes. So important to have proper shoes to exercise. So if you do have arthritis though, at certain times you might need to avoid some specific types of activity when joints are swollen or inflamed. If you have pain in a specific area, you may need to focus on something else for a little bit. And I will share a personal anecdote. I was fortunate to represent our Caregiver Teleconnection at the American Society on Aging meeting earlier this year in April in New Orleans. And the thing I love to do most when I'm in a city that's not where I live is to walk around and explore. And in the 2 days that I was there, in addition to the talks I gave, I walked 21 miles.
Woohoo!
And that was great, but my left knee was not happy with me. And so I said, you know, traditionally you're supposed to use the RICE method: rest, ice, compress, and elevate. I didn't have any swelling, but I found the thing that actually got me moving best was getting on a bike and getting on the elliptical. And it helped to reduce all of that swelling and all of the tension that I was feeling. And I will talk a little bit more about heat and ice in a minute. But I was wondering if anyone had any questions or any comments.
Just press *6 or unmute your Zoom. We really would love to hear from you. Honest.
Hi, this is Mary Phil again with Methodist Charlton. One of the things that is a challenge for a lot of managers or directors or people that have desk work, computer work, like they are sitting most of the time as part of their work. So what I normally do is I've given myself some projects for me. So every time my phone rings, I stand up. And that's intentional. And my phone rings a lot. Or I would put my iPhone on an alarm and say, okay, every 30 minutes, I got to get up and I need to walk, even go up and down the steps here, or do something for a few minutes, up to 5 minutes, and then come back. So those are some just helpful tips. When I go to the grocery store, for example, I purposely park farther from the entrance so I can walk more. Mm-hmm. The other thing is, instead of taking the elevator, if I'm on the first floor, I want to go to the second floor. Instead of taking the elevator, I use the stairs. So little things like that would encourage more physical activity truly is helpful. So
good for you. And thank you for sharing all those excellent tips. They're all right on point.
That's really thinking. Get out there and do it.
For those people that do have desk jobs, that is certainly a challenge. There are apps that you can download to your phone that remind you every 75 minutes or so to take a 5-minute walk or to get up and move around for 5 minutes. I actually do that when I'm teaching on campus, and I have doctoral institutes where they're pretty much all day from 8 to 5. So I make sure that all of my students get up because we're teaching healthcare and healthcare science. So certainly important to practice what we preach. But thank you so much for sharing those excellent ideas. The other thing too is people are getting desks that you can raise so that you have the option of standing if you want. And when I used to have an office on campus, I had one of those huge round balls that you can sit on. And I would use that instead of a chair because it helps to improve your posture and engage your core as you're sitting. So I would alternate between that and a chair. There are lots of great tips. If you have the interest in improving your health, there are always things that you can find to do.
Very cool. Anybody else? Let's see, did we get all the chats?
Don't see anything on my side.
Okay.
All right. So I will move on, being mindful of time as well. We have a few more health issues to get through. I wanted to talk about diabetes because for people with diabetes, exercise and physical activity, we know can help manage the disease and help you stay healthy longer. Now, walking and other forms of exercise can help to improve glucose levels, certainly in older people. Now, it's important here to set a goal to be more active most days of the week. And this is where goal setting is important, especially if you're trying to use exercise as a way of helping improve a health condition. Creating a plan for physical activity or helping to schedule it into your life can also be important. That's something that I've noticed with exercise classes that I'm participating in. I'm committed to them. They're on my schedule and it's time I carve out for myself. A lot of caregivers find that this is helpful for them because they know that this is their protected time and they schedule and plan for it. And if respite care is needed, that's when they arrange to have it. So it is important that if you are a caregiver, you consider what you need as well. But it's, as one of our participants said, just getting up and stretching can be important, and using television commercial breaks can be the time to do that. Walking around when you're talking on your phone, as someone just mentioned. So I want to thank you for all those tips and for your comments because you were reading my mind. It's also important, again, here to take more steps away from stores, movie theaters, where you park your car. So it's a delight for me to hear that one of our participants is actually modeling everything that I prepared and included in this slide here. I also wanted to talk about, certainly heart health. Talked a little bit about heart disease, especially among women. There are more women caregivers, more women with heart disease. It is so important that we keep our hearts healthy because our hearts keep our body running. As we grow older, changes in our heart and blood vessels are normal, but some can be caused by disease. Now, choices that we make each day, like eating healthy, maintaining a healthy weight, aiming to be more physically active, all of those can contribute to heart health. Interestingly, inactive people are nearly twice as likely to develop heart disease as those who are active. So again, we know this, it's proven. A lack of physical activity can also worsen other heart disease risk factors like high cholesterol, triglyceride levels, high blood pressure, prediabetes, overweight, and obesity. So being physically active is really one of the most important things that we can preventatively do to keep our hearts healthy. And according to the CDC, more than 60% of US women do not engage in the recommended amount of physical activity. More than 25% of US women are not active at all. Now, isn't it interesting that heart disease is so prevalent among older women? Any thoughts, questions, comments? Got to get active, everyone.
Yeah, move it. We had a presentation by a rheumatologist once, real specialist in all different kinds of arthritis. And he said, when we asked for a final comment, he said, move.
Absolutely. And if you look at the blue zones in the world, which are the areas in which people live the longest, it's really based upon a combination of factors, but a large part of it has to do with diet and exercise. Certainly true for the US blue zone of Loma Linda, California. People there report a lot more physical activity. Now, I wanted to talk a bit about exercising with osteoporosis because this is very important. And I love this slide here, too fit to fall or fracture. That's the goal, right? We want to be too fit for that. So it's important to include weight-bearing exercises, which force you to work against gravity. So those include walking, jogging, dancing, as I was saying. These are very good for building muscle and strengthening bones, which we know is so critical for osteoporosis. I really recommend strengthening and balance exercises too to help avoid falls, and I have experience with this. You want to avoid breaking things, so certainly improving your balance and your coordination and strength are important. It's very important for people who want to try to prevent falls and fractures. And also, as I mentioned, diet is very important too. So it's important that you make sure that you are eating a lot of almonds and getting calcium from different sources, and making sure that that you're engaging in physical activity. We know that this is a very important thing, so I can't emphasize it enough. Please, consider weight-bearing exercises, but speak with your doctor to see if there are any recommended things that you can do. Specifically, I also recommend physical therapy here as a way of getting a good routine together to help improve your balance and your strength.
And all you need is a referral from your doctor, right?
Correct, exactly.
And Medicare, pays for it.
Mm-hmm. Now, I know Medicare doesn't pay for a lot of sessions, but that's why if your goal is to go there, get an assessment and get a workout routine you can do at home, that's something that you can ask for of your therapist as well, and your doctor. So it's important that you have the conversation so everyone knows what the goal is. Now, exercising with chronic pain can be a challenge for a lot of people, and it can certainly be a barrier to getting started. But again, most people living with chronic pain can exercise safely. And more importantly, it can relieve things like pain management. In fact, being inactive can sometimes lead to a cycle of more pain and loss of function. So please speak with your doctor, again, about what exercises and activities might be right for you. Each type of exercise, endurance, strength, balance, flexibility, they each have their own benefits. So a combination might be best. Now, exercise can also help you maintain a healthy body weight, as I was mentioning, which can help to relieve knee or hip pain. Putting extra weight can slow healing and sometimes make pain worse, as we know. And it's so important to remember to listen to your body when you exercise. If you're feeling pain, stop. Avoid over-exercising on good days. As I was recounting my story of walking 21 miles in 2 days, I'm usually at a desk, so that's so far out of my routine, and I didn't have the appropriate footwear with me, and I knew better. But I share that because, again, you have to listen to your body. And if you are feeling pain or inflammation, it's important to be mindful of that. Heat and ice are very helpful. Sometimes a combination of the two, sometimes one or the other. Again, it depends on what works for you. We have to remember that ice helps to relieve inflammation, whereas heat can sometimes make inflammation worse. So think about the kind of pain that you're feeling. If it's muscular, for example, but there's no inflammation, heat can be very helpful. I personally am a fan of ice. I believe ice is like my best friend. You can even buy cryotherapy machines at home. And if I do get swelling in my knee, that's what I use. But again, pain rarely goes away overnight. And it's important to speak with your doctor if you are encountering pain when you do work out, because again, there are customizable workouts that you can engage in. So I want to share some resources with you all that I will circulate along with today's presentation and slides. And I'm mindful of time, but I wanted to open it up and see if anyone had a last question or comment before Evelyn shares some information about future programs with you.
Yeah, just press *6 if you're on the phone, unmute yourself. I want to hear from you. It's been a fabulous presentation, Elliot.
Thank you. Now, I do want to ask our participants today to do two things for me after we're done. You will be receiving a post-session survey, and I ask that you please complete that so that we know if you enjoyed our time together and how we can better serve your needs. The other thing that I want to ask you to do is when you're done with our program today, please get up and walk around for a minute if you can. Let that be your cue and your little break and something that you do for yourself today. And if you can get outside in nature, if it's nice where you are, take a couple of minutes.
Perfect. Wow. Well, before I talk about the future sessions, Elliot, I would like to say your beautiful slides, your research that you bring, always bring us the latest research. We're so lucky, to have your presentations because you make them the best. And your slides are, sort of intimidating for those of us who try to do slides. and sticking a video in the middle of it, I don't know how you did that. So thank you so much.
I appreciate that. It's my pleasure. This is something I love, and it's from my heart, and I'm really grateful to share it with everyone.
Excellent. Well, let me tell you folks a little bit about what we've got. We've got kind of a quiet month here because people are on vacation. Or having weddings or doing something like that. We're going to answer common dementia questions with Tam Cummings tomorrow. She's very, very well versed in dementia. You can ask her anything. She's just always knows the answer. On Monday, we're going to talk about medications in older adults. That's next week on the 11th. On Tuesday, the 19th, we're going to talk about Alzheimer's disease, symptoms, stigma, and sexual expression. And that's always one that it's kind of hard to talk about. I think people are reluctant. They feel like there's some stigma to talking about sex when your person has dementia. So don't miss that one. On Wednesday, the 20th, we'll be talking about using a positive approach to dementia. And that's guided by Teepa Snow's Positive Approach to Care. And you'll walk away with some tools to aid in caregiving for loved ones with dementia. On Tuesday, July 26th, we've got Mary Jacobs presenting on what new family caregivers need to know. And, it's like going back to Caregiver 101, but people get diagnosed every day, so we need to keep going back and making sure that people have the tools they need. On Wednesday, July 27th, there will be a Spanish presentation. Let's see, I think it's something like, do you really need a doctor to see it, to go to use a doctor? I don't know, Minerva, you want to correct me? No, guess it was close enough.
It's, do I really need a power of attorney?
Thank you. But that really helped. Appreciate it. All right. So given that Elliot's already talked about the post-session questionnaire, I just want to thank all of you for being on with us today. It was a fabulous presentation, Elliot. I want to thank the Women Charitable Foundation for the support and the incredible job they do, including you, Minerva, especially you, as our customer service representative. And the resources that Elliot talked about and the post-session questionnaire will not come to you unless you're registered for this session. If someone has shared the information and you got on that information, if you got on this website but with that information, you would really need to call our WellMed customer service, Minerva, at 866-390-6491. That's 866-390-6491, and get registered. And you'll not only get registered and get the resources and the post-session questionnaire, but you will also get the monthly calendar, which is pretty spectacular. And we have so many good things and so many topics that are various and answer different people's different questions. And we can share, the caregivers can share how they've, dealt with some of the topics that we're talking about. So with that, I want to thank you all so much, ask you to have a great, safe day and get up and move. Elliot, last word?
Thank you so much, everyone. And I echo that. So when we're done, get up and walk around, get up and move. And thank you so much again for participating. Have a great day and stay well.
Goodbye, everyone, and thank you.
Bye.